How are you, Dr. Adi?
I'm great, thank you.
Yes.
How are you?
I'm well. I wrote a flattering blurb about you, which I'm going to read. So today we're joined by Dr. Adi Soffer, a licensed clinical psychologist who works with children, teens, and families. She specializes in anxiety, OCD, family therapy, and behavioral parent coaching. In my experience, Dr. Soffer is a warm and thoughtful clinician who helps clients build resilience, improve relationships, and develop practical skills for everyday challenges. Dr. Adi, thanks for joining us.
Thank you for having me.
Okay, so today we're going to talk about family systems work, which you do.
Mm-hmm.
So in simple terms, how would you explain family systems to someone who's never heard of it?
So in family therapy, as opposed to individual therapy, you want to take a look at the whole system, at the whole family as a system, and the interaction between the family members. So how is their communication style, what is going on in terms of hierarchy, and dynamics between the family members. And you basically understand that when you shift one part of the family, everything else changes.
Okay, so the client is not just one person, it's the whole unit.
Yes.
Okay, got it. When do you recommend taking a family systems approach versus focusing on individual therapy? For example, if a 13-year-old is struggling with an eating disorder, how do you decide whether to involve the whole family in treatment or work just with the child?
So it's interesting. I actually think that every family that I talk to, I tell them that we are going to integrate some parts of family therapy.
Okay.
While I work with a child and I want to focus on the child, especially a teenager, I want to focus on them so they can have a safe space to talk about their feelings. I also want to integrate their family members. So for example, if the child has problems with eating disorders or things like that, or anxiety or depression or whatever that is, the parents can have so much effect on how the child is actually, how the symptoms are presenting. The siblings have so much effect. So I want to help other family members in the system understand what is their part on the child's symptoms and change that, so then the child doesn't need to change alone.
I like that. And that's your clinical preference, right?
Yes. Yeah. Yes. So I actually start with any client that comes to me, I start with a family session.
Okay.
So I bring the whole family together and we don't talk about the child. We don't talk about the problems. We don't talk about anything. We just talk about the family as a family. And this is also a great way to help the child feel more comfortable and not feeling that they are the problem. Yeah. Right? And so it's a great way to bring them in.
I like that a lot, because in old school Freudian therapy, it was like the cone of silence of the therapy room, and I understand the thought behind that, but there's something very pragmatic about the people who you spend the most time with should be involved in treatment. Yeah.
And more than that, I just feel that when we are working with kids and teens, they don't live in a bubble. They have everything that they're experiencing, everything that they're presenting comes from somewhere. And I have to understand, where is it coming from? Yeah. And so seeing the family, seeing the parents, how they interact in the room, how the sibling affect, the way that they're presenting themselves. It's more of the non-verbal communication that I can see in a room, and their interactions and dyadics and just like dynamics between themselves that really helps me understand a lot more than sitting in a room with just a child.
I like that, because a kid can say
whatever they want.
Yeah, exactly. Yeah. My mom's so unfair, but if you see the whole thing, then okay, I like that a lot. That's actually great. Okay. Many parents focus on fixing a family member's, often a teen's, behavior. How does a family systems approach reframe that goal?
So in the family system, like we said, there's no one identified patient. So we want to understand that everyone has something to do with the problem.
Got it.
And so this way, not only the child feels heard and seen because they understand it's really not just about them. Okay. The parents also gain a lot more control because they can understand that there are things that they can change in order to help the child change as well. and also the siblings, but everybody else.
Got it. So if you have one sibling who's kind of the identified patient, who's the screw up, who's not doing well at school, who's some behavioral problem, and then they have an older sibling who's, star athlete, straight A students, what would you say to that member who's like, hey, this has nothing to do with me? Yeah.
It's actually really interesting because many times when the child comes to therapy, and that's the problematic child that comes to therapy, I like to look at the other child. And also tell the parents, look at him, look at the other or her, right?
Yeah.
Look at them, because this child gets so much attention for their behavior. This is their way of, showing signs like, hey, I need attention, and everybody dive into giving that child attention, while the other child may have the same problems and the same, struggles with themselves or around them, but they will never show it. And I'm actually so afraid that this is the child that is going to suffer in life more than this child.
Oh, really?
Because at least this child shows their emotions.
Yes.
And they can, they ask for help.
Yeah.
They show, when I see a child that is exhibiting so many problematic behaviors, I don't look at the problem per se. I look at the underneath. What is the need? What are they looking for, right? But when we have the other child who always tries to be perfect and to show as if like nothing bothers them, and they are the best students and they have everything, they're good, and they keep saying, it's usually like those kids that would come to their parents and be like, I'm good, don't worry about me, focus on them. What is going on there? They don't get enough attention. They don't get enough of their needs.
If it's too good to be true, it probably is.
Yeah.
Okay. That's good to know. Have you ever had any resistance in communicating that, or is that something you communicate with families, or is the star student like, no, I'm pretty sure I'm the star student? Like, how does that work?
So I try to say everything that when I talk to families, I try to just, first of all, help them feel validated and help them feel supported. And then I can say a few words and just leave it out there. Because sometimes just to plant the seed is enough. So I don't need to go right in and say it.
So what, just for a hypothetical, so let's go back to our two kids. Mr. Screw Up, Mr. Perfect. What I hear you say is the parents have a fair amount of influence on how those kids in the system see themselves. Are they the ones who are usually the point of intervention, or is it with the kids, or you just float the idea out there?
Yeah, so I like to work with the parents most of the time. I like to help them see the family system and the dynamics between everyone, and to help them take a step back, because many times families that come to me, they're so busy and they look at just the micro level of what is happening in the moment and in the symptoms that they're noticing in the moment. But I help them take a step back and look at the whole system again, and to understand that, yes, you came for this one child, but what's going on there? Or let's see what we can do as parents to change everything in the house by changing your behaviors with everyone in the house.
A big part of family systems is how everyone's sort of interconnected. So I think the classic example is, 13-year-olds having a hard time, but parents are fighting, and it might be a way to bring the parents together to... How do you communicate that everyone has an effect on each other, even if they're not aware of it?
So when I work with a family, I try to help them understand that there is a system. And in any family, we want to see some units that function in the system, and we want to see the hierarchy and the communication between the units, right? And so many times I can see that the parents' unit, which should be two of them together at one place and have some type of a clear communication with their children on the bottom, sometimes that's not necessarily the way that they come to therapy. Sometimes one of the parents are kind of like went down and now they're part of the children's system. Maybe they're just not communicating as one unit. Maybe there's a child that kind of like stepped up and now they are controlling the whole system. And so I want to really show that, and I've basically put it on paper to show the family how does that look like right now, and what is the goal of therapy. And the goal of therapy will always be to have the two parents, no matter what, if they're not together, that's okay too, but they still need to co-parent and to work as one unit in the top, and then to have some type of a clear communication, meaning that they can talk to the unit below them, which usually should be the children, have an open dialogue with them, but also clear boundaries and routines to help the child feel safe as a child, right?
It's paradoxical. The clearer the boundaries, the more relaxed everyone is.
That's very true. I mean, in general, when the child has clear boundaries in the house and very clear routines that they know that they can rely on, they feel safe to be themselves. But when there are no clear boundaries and they don't understand if they will do one thing, something else can happen, the parents will react in a certain way, but some other situations the parents react in a different way. And right, so when the child doesn't feel safe in this environment, their anxiety will rise, and that's where we see many behavioral problems with the child. So it's important to help the child feel that, we are, as parents, we will take the lead, and we will show you the way, and we will let you just have some limited control, because this is good for you. This is our job, and your job is to be a child.
You'd think, a lot of kids think, no, I want to be the boss, I want to be the boss. It's like, okay, sure you do. There you go.
Very true.
I imagine that whether it's a classroom or a family, some people naturally warm up to you right away while others hold back. How do you handle those differences in engagement? Do you have strategies for connecting with everyone without showing favoritism?
So this is a very interesting question. I think that I take a step back. It's really not about me. And I want to explain that to the family. I'm just a tool here. I'm here to guide you so you can have better relationships with yourself. I really believe that therapy should be temporary. My style of therapy is very goal-oriented, and I try to help them just get all the tools and change dynamics and have better communications within themselves, because they will have, themselves for the rest of their life. So I want to make sure that they are good. So it's really less about the way that they interact with me, and that's what I do in the session. So in a family session, I just have them play together. Okay. And I have them, I arrange an activity for them to just be with themselves while I take a step back and I just observe them. In that way, I can really see what is happening, right? Who is letting who is the first one to take a turn? Who is what happens when someone struggles in the game? Does anyone come in and explain them? Just this week I had a family of 4, and we had like 4 characters in the game, but they chose for some reason to have 2 teams. So that's very interesting. They do it so naturally, but to me, it says so much. Why is there a team? Why not individuals? So we're looking at just parent system as parent system and children as children, but we need to have some individualized, relationship with each member of the team. So that's the best way for me to actually see what is happening with them.
I like that a lot. And stepping back is a great way to just observe. Yeah. Teens often crave independence, but families still function as a unit. How can parents respect that independence while staying connected?
Yeah, wow, that's huge, and that happens a lot. I think that for parents, especially when they face, their first child becoming a teenager, but not, sometimes not, but still, sometimes when it's the first child becoming a teenager and stepping away from the family system, that is a big shift that the parent does not really know how to handle. So I think that first of all, my role is to help the family or the parents understand that this is natural and this is what the child or the teen needs to experience. So help them see that there's nothing wrong with the family system, and this is actually supposed to be part of the family dynamic, and that's supposed to happen. And to help them take a step back and observe what is happening and how can we look at the family from instead of critiquing that and instead of seeing that as a problem, as seeing that as, okay, if he's changing, how can we change with him? How can we talk about this change? How can we help them, branch out and seek more of that independence and individualization that they need to experience, while also create some routines in the house to still keep the system working.
Yeah. And if you're going to have independence anyway, okay, you want to sign up for soccer, great. You're going to do your own thing, and we respect that. But if you clamp down on it, then it might come out in other ways. I'm going to sneak out at 2 a.m. or something.
Exactly. So that's why communication is key here, right? And keep your kids closer to you. Open that communication, because if you will not be there to communicate and to talk about those changes, to talk about what the children experience in that moment, they will just stay away.
Yeah, the independence is coming whether you like it or not. So.
Exactly.
Okay, I like that. Were there some healthy ways to shift family roles when a big change happens, like a move, divorce, or a new sibling, without any member feeling lost?
I think that it goes back to communication. I think that many times parents feel that they should hide things from their children and they should just not talk about things, which is actually wrong. The best way to deal with big changes is to talk about it and to face it straightforward. So it depends on the child's age to be able to communicate in the way that the child can understand it. Is important, but also to communicate the parents' feelings with this change, because many times parents are like, yes, you're just going to go and live with your dad, or we're just moving to a different city, or something big is happening and they just say it with no emotion attached to it. But when the parent feels safe to say, I'm really scared too, I have no idea what's going to happen next. But we're going to be together, and we're just going to do the best that we can together. That shows that can create a safety, place for the child to also express their own feeling. Yeah.
So if you worked with, say, a divorced family, is it the same as working with do you still have a session with everyone involved, or how does that work?
So usually, yes, I do have a session with everyone involved. I think that it's important to bring the parents in and to help them communicate in a way that it's not about them and it's more about the kids. And I always try to help parents, and I have many parents that are divorced when I work in my practice. And I try to help them understand that even though they're not together, the family should stay the same, and the way of communicating with the kids should be the same. So I like to still have parenting session with both of them, and to have the same message be sent to them, and for them to send the same message to their kid. And when I see that does not happen, I usually bring the family together again, and I communicate that in a room so they can, so that the child can see that I'm there for them to help them bring the parents together. If that's a teenager, if it's a younger child, maybe I would do it a little bit differently. But it's important for the parents to understand that they're still the parents, and they should still act in the same way that we want to see in a family system.
What's one small, realistic change a parent can make this week that could strengthen the family system as a whole?
So the first thing that I usually tell parents is that instead of looking at the problem, take a step back and look at what actually works in the house. What some behaviors that your child is exhibiting that are positive. And I usually notice that they come back and they say, wow, like things really changed this week. But they didn't do much, right? They didn't do much. Nobody changed, but it's just more of the perspective of the parents looking outside of the problem and taking a step back and seeing what actually works in a household that really shifts the way that they see everything.
If you could give one piece of advice to a family raising a teen right now through the lens of family systems, what would it be?
I think that slowing down and taking a step back and noticing what exactly is the need right now versus the behavior, right? So a child can exhibit aggressive outburst or withdrawal or just pushing away or all of those things that can seem so big and so scary to the parents because maybe these behaviors are different now. Take a step back and understand what exactly do they need right now? What can we do as a family to help the child, right? So if it's to give a little bit of space or to actually bring back some rituals that help the family stay, input and to stay, to have their cohesiveness. So I really like to tell parents, like, you can just do a little bit of check-ins every day and to say and to have, the family members share a little bit of like something good and something bad that happened today. And that just on itself helps creating this bond again and helps creating those moments together where the child is kind of like coming back to the family, understanding that like this is bigger than just who they are in a moment.
Dr. D, thank you so much. It's a privilege to hear your expertise.
Thank you for having me.